vitamin D and the more research that comes out around it, vitamin D impacts over 6,000 biochemical pathways in our body. Okay. So, and low vitamin D levels are related to all-cause mortality as well. It's immune, it's mood, it's so many different things. I didn't understand when I was younger why I was a very healthy child until I wasn't, right? And my vitamin D levels were low. They finally tested them and I was like in the teens. It wasn't until I understood my genetics. I need a very specific dose daily to keep my range, and knowing what I need. It's just like everybody says, you never get sick. And I do. I feel like being exposed to things, my body has the ability, just because I keep my vitamin D levels at such an optimum range. It's so important as they learn more and more and more about vitamin D. Yeah.
And you know what's crazy about this particular client is that she has Parkinson's diagnosis, an early onset at 52. So for her levels to get into range, despite having a very difficult neurodegenerative disease, is really encouraging, right?
I mean, anything that we can, if we can support the DNA, the base of our own health at a higher level, without the mass confusion around it, and support it. I just think in general, it's healthier outcomes. And when we go to heart health, 80 to 90% of all heart health conditions are they are totally preventable through diet, nutrition, lifestyle. So I'm not saying that in a specific, you're talking very specific case of Parkinson's, but what if we get the body more optimized so that the onset of symptoms and are lessened, slowed, etc.